Hello and welcome to Cycle for Health in London, the channel that showcases safer cycle routes between London's hospital sites. My name is David Lincoln. I'm a nurse and I cycle regularly in London. I currently work with older people in the community, but previously I worked with people of all ages, including children. I'm also a father with a son and a daughter. So I have a vested interest in child health and in children being able to get safely around London. Today's route will focus on two great children's hospitals in London. The Great Ormond Street Hospital in Bloomsbury to the Evelina Children's Hospital in Lambeth. As usual, we try to avoid busy streets and stick to protected cycle paths and low traffic neighbourhoods where possible. The whole route can be cycled in under 20 minutes, so it's quicker than public transport. So off we go. We start at the Great Ormond Street Hospital, which was formed in 1852 with a mission to focus on the child first and always. The hospital sees about 750 seriously ill children per day. Great Ormond Street has about 4,000 staff and 1,000 volunteers. That many people couldn't drive into this central London location, otherwise there'd be total gridlock. There are ample public transport options, but cycling can be a good choice too. Congestion in busy central London streets can make bus journeys slow, but bike speeds tend to be more consistent and journey times more reliable. Bikes are resilient to weather conditions and to unexpected obstructions like roadworks, as you can usually find a way around or through such blockages. The Great Ormond Street Hospital Trust says it wants the hospital to be a great place to work and pledges to invest in the well-being of staff. Active travel is proven to improve general health and well-being. Regular cycling can strengthen our physical and mental health, boost our cardiovascular fitness, and reduce our vulnerability to infection and a host of health conditions such as dementia. It makes sense for Great Ormond Street to support measures that will get their staff and volunteers cycling. I believe that outside every hospital there should be a healthy hospital street, so that patients, staff and visitors find them safe and welcoming spaces in which to arrive by cycle or on foot. I understand that a healthy hospital street is actively being considered as part of Camden Council's Livable Neighbourhood Plan for Holborn. The healthy hospital street could be similar to healthy school streets. Healthy school streets create a safe and healthier environment outside schools to encourage active journeys and provide a safer, healthier and more pleasant environment for parents and children. The schemes help to discourage car trips, particularly amongst parents and carers, by providing a safe and inviting space for more walking, cycling and scooting. Movement in childhood is crucial to laying down the groundwork for better overall health as an adult. But UK activity levels have decreased considerably in the last 30 years. Now only 22% of children aged 5 to 15 are reaching the minimum physical activity level recommended in UK guidance. Movement in childhood is vital to laying down bone density, building muscles and acquiring motor skills. Children want to move. When we survey school children, many say they want to cycle to school, but few actually do, even though cycle ownership is relatively high. The main reason that children don't cycle to school is that their parents won't let them, because they don't believe it is safe. The dominance of motor traffic has created a genuine peril to outdoor play, setting in place a vicious circle in which parents think the only way to keep their children safe is to drive them everywhere. 25% of pupils are driven to school in inner London daily, which puts an extra 240,000 cars on the road every morning, and the same again at pick-up time. Besides the health and well-being benefits to children themselves, enabling kids to cycle themselves to school would make many car journeys unnecessary and reduce congestion. This is important because road transport is currently the single most significant contributor of air pollution in Greater London. Children are more vulnerable than adults to breathing in polluted air because their airways are smaller and still developing. They also breathe more rapidly than adults, meaning they take in more polluted air. Children can also be vulnerable to air pollution because they're normally closer to the ground or at face level with car exhausts, whether that's walking or in a pram or buggy. If your child breathes in high levels of air pollution over a long period of time, they might be at risk of their lungs not working as they grow older. They might develop asthma during childhood or as an adult. And if they have asthma already, air pollution can make it worse. Children are always vulnerable road users. Amongst bustling city traffic, their size may make them less visible to drivers, and they may not have a clear view of traffic over obstacles such as parked cars. Even when they can see the traffic, their developing brains may lack the ability to correctly assess speeds and distances accurately. Curiosity and impulsivity are normal features of childhood and may result in distracted behaviours and unsafe road use. Children need to be taught road safety skills, but we also need to build a cityscape that acknowledges their needs and affords them protection. The evidence is clear. For the sake of children, we need to change the way we move around our great city. We need healthier streets, more and better protected cycle lanes, and low traffic neighbourhoods so more people can participate in active travel. We need to liberate children so they can move freely and independently. We need to protect their fragile bodies from motor traffic collision and their growing lungs from air pollution. As health professionals who participate in active travel, we can role model physical activity and be advocates for a cleaner, healthier city. So here we are, safely at the end of our journey. If you found this video useful or interesting, then do subscribe to the channel. If you want more safe cycling, then check out London Cycle Routes, where John Stone produces new cycle routes almost every week. If you're still not confident of cycling the route on your own, then check out London Cycling Campaign's Cycle Buddies. So it's goodbye from me, David Lincoln, and I hope you'll join me again and cycle for health in London.